Okay, hello everybody. Welcome back to another episode. Here I am with Hannah Anderson, and she's listed on the America First Policy Institute, Director of Healthy America Policy and Senior Director of Policy. She focuses on health policy initiatives aligned with making America healthy again, which includes reforming SNAP to promote nutrition over junk food, advancing drug price transparency, health technology innovation, as well as FDA reforms. Welcome, Hannah. We are glad to have you on our channel.
I'm so glad to be here and thank you so much for having me. What a kind introduction. And yeah, we do a lot at America First Policy Institute in everything you mentioned and even more. So, it takes a lot to have a healthy America. So, it's really a joy to be able to focus on all of that and really figure out how to make Americans healthy again.
Wonderful, wonderful. And I, of course, am in the insurance space. There's a lot of stuff, that could be seen as good, could be seen as bad. But really, what I want to do is I want to help people get an overall understanding as to this huge healthcare machine in America. So as once people understand this machine better, we can try to implement better parts to make everything move more smoothly. And you're somebody that understands this very well, this machine very well, better than I would say the typical person. And I am grateful that you reached out and to have you on here. So before we get in, can you please share with the viewers a little bit about your story, your history, where you're from, all of that good stuff?
100%. Yeah. I mean, like a lot of other people in healthcare, it started from a very personal connection to it. My dad passed away when I was 6 years old from a very rare form of lung cancer. It was a form of lung cancer that was probably through environmental exposure. We had health insurance at the time, but my mom was afraid to get my dad checked out because at the time there was no protections for pre-existing conditions. So if my dad, had cancer and they found that early on, they were worried that he wouldn't have lost his coverage, but he was looking to change jobs. And in that change, he might have lost his coverage. He ended up passing away because they caught it at stage 3, and then we were on the state provided health insurance program. So bouncing around between Medicaid and CHIP, and grew up on those programs, and never thought that I'd actually be in health policy. But, I've been a beneficiary of the American health system, both in the private side, the generosity of others, the physicians at church who said, they'll obviously take care of us because of the mission, that healthcare is a ministry. And then ended up in Washington, D.C., and, really was able to work in public policy and fell back into healthcare. And so I love healthcare policy because it is the thorniest and messiest of all the issues, because there's no other issue out there that's going to get to the heart of people as fast as healthcare. There's nothing that's going to make people more angry that you're messing around with their health and they're messing around with your money, and it feels like it's all out of control for you. And then it's also, the out of all the different health policy spaces, it feels like it's the one that politicians love to talk about the most, but not do anything. It feels like it's the one that there's the most big business and big influence. And it feels just like, does anyone actually care about me, the patient? Do they care that it's my money and my health? They talk about preventative care, but they actually care about changing the system so that I can take my money and put it where my mouth is, which is I want to stay healthy. And so that's where I love, I worked for a series of different members of Congress. I worked for the Senate committee that handles health insurance. I was actually the lead on a really big bill of transparency ideas to get to advocate for the American patient and be the one, when you see all these bills come to the floor and you say, who has to read them? Well, not only someone has to read them, someone has to write them. And so that was part of my job too, is negotiating every shall and may and every little comma in those bills to make sure that it's exactly what we needed it to be. So did that, ended up working in the Senate, was able to help lead the transition team for the president, President Trump, as he came into office. went into HHS to help them stand up the department. And, that meaning really trying to get them up and running. And not just MAHA, where people think of MAHA when food dyes and healthy food and the food pyramid that just got, reformed, but also, how do you attach dollars to that and really make sure that as I'm trying to get healthy, as I have, and my camera's blurred because you wouldn't see how messy my kitchen is. I've got my kale salad here from lunch today. Because again, I know here's what I need to do to be healthy, but how can my health dollars connect with that? Not paying for food necessarily, but how can my health dollars pay for a preventative visit to the doctor? How can it pay for, I love the Whoop, the Aura Ring. How can my health dollars and health data help support me getting a better understanding there? So like I said, everyone else in health policy has kind of a journey that they've gone through personally, but I've gotten so lucky because I've gotten to take my personal experiences and really connect that to what I think is the heart of the matter here, which is the only way you're going to make Americans healthy again is if you give them the person more responsibility, accountability, and ownership of their health and their dollars. And that's what I get to do today at America First Policy Institute.
Wonderful, wonderful, wonderful. And there's really, from my own so far getting it, being into this space, there's not a lot of people that really do anything to promote change. It's a small number, of course, and it's very difficult to find these people. It's not like they have massive media teams and they're going to be blasted everywhere where it's a mainstream thing. But it's very important because obviously people go through hardships. I myself went through hardships being with my family, going through medical catastrophes. That's part of the reason I am doing what I'm doing today, and to give people a voice, such as yourself. So we're looking to connect with more professionals here in the space too, to talk about the more because it's not as simple as no cost healthcare, right? We talked in our last call about the dangers of it and where we're seeing the dangerous sides in areas outside
Yeah.
of America. But still, the unaffordability here in America is a massive problem. And I
Yeah.
actually, a couple of years ago, saw that costs and medical expenses have risen over like 300%, which is ridiculous. It's absolutely ridiculous. Now there are factors that are causing this, and it's part of the reason we put this channel together. We have a proposal we think can fix some of these, but we're waiting to knock down some of our goals first before we start diving into that. But let's talk about some of the important things that you guys are doing to help bring about some transparency and maybe like helping out with the unaffordable or the problem that is affordability in healthcare. Would you like to touch on any of those points?
Yeah, of course. And what I think I had really, I started seeing your videos on Instagram and I saw them and I just got so angry because this is the kind of healthcare system that I know to be true, which is why am I paying such a high premium to also have a high deductible, to also then pay 30% of my costs in coinsurance? It's frustrating and maddening when you don't know what the price of a service is before you go in and get it. It's the last place on earth where you go in and you buy something that's very expensive. You feel like you have no say in it and then get the bill and people wonder why there's medical debt. And so it feels very frustrating to me because this is the healthcare system I know to be very hard to navigate. But then in the health policy space, it's all sunshine and roses. We just talk about affordability because, well, there was a one-off or there was a mistake or we just need more subsidies. But no one's really taking a heart to the matter that patient last policymakers, and I'm not demonizing anyone here in political party, but truly like patient last policymakers, where you're thinking of everyone but the patient. And whether that's you're thinking of the bureaucrat or thinking of the company, all of those need to be in service of the patient. So if the patient is paying, you know, I would say at the low end for an individual plan, $400 a month to then have a, $1,200 deductible, to then have to pay 30% in a copay anytime they go see the hospital. To me, I say, you know what? That's a little bit of the opposite of what health insurance is supposed to be, because insurance at its core is a tool to prevent financial loss. And insurance is an incredible tool. And this is not to ever cast aspersions on insurance at the core, because insurance is an incredible tool that has saved people from financial loss. So my question is, why has it actually created people going into financial loss if this is a tool to help prevent people from losing their homes, losing their lives in some cases? So what needs to happen? And so as a policy expert, I am really excited because I get to go in and say, what do the bones of this system look like and what needs to change? Because ultimately it really needs to change to make you and I have other ways to finance our healthcare outside of health insurance. And that's what I think when I see all your videos and see, your followers are doing and see, all the voices that you're amplifying is people have been trapped into a system that has said the only way to finance your health care is through health insurance. And they don't think through health insurance. They've not been taught to think through health insurance. Policymakers have said health insurance is the end all be all, but they don't realize that health insurance is only one of many tools in their toolkit that they have to actually pay for their health care. And one of the women that you highlighted just recently, she's talking about her costs and her coverage. And she was kind of doing the math and finding, wait a second, it might actually be a little bit cheaper for us to have a really, really low premium, a really high deductible, keep the premium for really emergencies, and say, we're just going to pay cash for everything, because we don't really need a low deductible. We need a low premium. And so yeah, I'm really focused on figuring out the mismatch because we have this intent from policymakers, from the community that really have said, we really want to figure this out. We have the law and the regulations that are clearly having an impact. And then we have a community that's been so impacted who can't afford their healthcare costs, or it's just not consumer friendly. Why can't I went to the cardiologist just because again, you do your checkups and you say, I'm finally at a stage of life where maybe I need to go see the cardiologist just to check everything's working well. I immediately go in there and they say, we need to do all these diagnostic tests on you. I say, hold up, hold up. Let's start with listening to my heart and a blood pressure test. See how that goes before we escalate. Well, that's just what we do here. We just do diagnostics. And I said, no, 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 no. Because that diagnostic could be 80, 800, or $8,000. And until you tell me if it's 80, 800, or $8,000, I'm going to say no until we really figure out what's needed. Because remember, I came in here not because of an underlying health condition, just because I said I want to take a hold of my health. And I know that there is at least one member in my family who had heart failure. And so I want to just make sure everything's okay. But I'm not going to walk in here and pay an unknown amount of money that I'm only going to find out on the back end. But you have to tell me. So consumer unfriendliness. Why is it just expected that I'll walk into a doctor's office and no one will explain to me what's going on? You know? So anyway, again, going back to the whole system's incentives have been aligned against you and I, the patients. And that's really, again, what I'm looking to try and figure out at AFPI is what do we need to tweak and change to make sure that you, Brandon, me, Hannah, and all the other rest of the community are actually getting to benefit from a system that's, I think, it's $5 trillion, a quarter of the GDP. It's a lot of money to spend for either of us to not really benefit from it.
Absolutely. Absolutely. And I know from when I read your paper talking about drug transparencies. So, I mean, let's back up here because as I continue to do I obviously am on the front side of health insurance, right? I find people a plan and they basically purchase that plan.
Right.
I don't offer ACA. I'm not the biggest fan of ACA. But I see just so many stories of people having obviously claim denials and they're having issues. And it really doesn't make sense why they're denying. I mean, if you're providing bad services to a free market, ultimately you should end up dying out. And part of the problem, I think, and I'm a ferocious reader. I'm constantly reading, and economics is one of my favorite places to study. And the transparency models we do need, like, why can't we go to a hospital and see a menu of prices like we do a restaurant?
Yeah. I love that you asked that question because health price transparency has been one of my passion projects, not just when I was in the United States Senate, but also at AFPI and also during my time on the transition and at HHS. So price transparency is so challenging because it hits to the core of the problem. Um, that the system is not set up for you and I. It's set up for all the other entities. And you and I are just covered lives. And I know you being in the insurance industry, you understand that we talk about patients, not as the consumer, but they're the beneficiary. They're the covered live. It's almost it's almost paternalistic because you're talking about them as if, yeah, whatever. We've got them, right? Like, don't worry about it instead of saying they are the payer, the consumer, the customer, the patient, they're the one in charge. And the problem is, since you and I don't control our healthcare dollar, no one cares about making sure that I have the best information, that I have accurate pricing information, that I'm informed about the care, because they don't have to sell to me. They have to sell to my health insurance company. They have to sell to my employer. They have to sell to a hospital. They have to sell to a pharma company, or even worse, they have to sell to the government. And so I think, again, that's the heart. Transparency is so difficult because it gets to the heart of the matter. You know, the first few years that we were talking about health price transparency, that was 2016, 2017, 2018. The word on the street was, why do we care? Right? They were shopping this around to policymakers and staff on Capitol Hill to say, why should you care? Like, patients only care about the copay. Why should they care about the cost? They don't have to deal with the cost. And I said, it's an attitude change, right? Like, it's an attitude change that the hospital, the health insurer, the government needs to remember that it's not the insurer's dollar. It's not the government's dollar. It's not the hospital's dollar. It's my money. And they are supposed to be taking care of that in the most effective, most delicate, most efficacious way. And instead, they're spending it on nothing. They're giving me zero value for the dollar. And they're really not proving their worth because I'm like a great shopper. And I have no shortage of shoes or clothes or being able to really find a good bargain. And somehow it's a system that has said, we don't actually believe you're a good shopper when it comes to healthcare, even though you're a good shopper when it comes to shoes. Okay. But you're also a good shopper when it comes to your retirement account. We trust you with your stock trades. We trust you with your, investment spending. We trust you with your car insurance, your house insurance. You can make mortgage decisions on your own. You can shop around for that. We trust you with all sorts of means of financing. So why can't I be trusted as a consumer with these other things that are huge deals? Right, like retirement account, that's me saying I'm trusting the American consumer to make wise decisions in their 401k or their Roth and say I'm going to save money over time for like when I'm not working. But how come that I'm not trusted with any information to shop around for a primary care doctor? Because the insurance company, the private, the primary care, the hospital office, and the government has all decided that I'm going to make a bad choice for myself. And that's what they've sold on the Hill time and time again, is that I cannot take care of myself. But now we're seeing, and Bobby Kennedy has done a great job, saying, y'all have not taken care of her. Her health outcomes have gotten worse, and not me necessarily, but like me as a patient. My health outcomes have gotten worse. I've slipped down to the bottom of the list in terms of health outcomes in OECD, and we pay more than every other country for those worse outcomes. And that's because of over the last 30, 40 years, we've had patients, last policymakers go around and say they can't make decisions for themselves. We have to make them. And turns out all that's done is say, I'm unhealthier and more expensive than ever before. So that's why, again, like my papers, my work, the stuff that I've done has all gotten back to how do we give the patient the ability to make decisions for themselves, not just through transparency of all sorts of public health information, but transparency on the very first thing that belongs to me, which is my price. And this, if you solve just this one problem in healthcare, right? I had a young man at work come up to me and say, Hannah, I went to the ER for strep throat. Everyone and their mother got sick over Christmas. We have lots of fun little diseases going around. I'm sure you got sick too, Brandon. But everything was going around. He just needed a strep test. Okay, doctor's offices weren't open. He went to the urgent care. Urgent care said it's strep. Here's antibiotics. Sent him home. He comes back. He says strep's not going away. They gave him another strep test. It's still strep. He said, take a little bit more time, see if it goes away. Okay. And he's paying his little like copay each time. The third time he comes back and he says, strep test still like, I still feel like I have strep. I might need stronger antibiotics. They sent him to the ER for a strep test. And in my head, as being probably in the top percent of like well-informed healthcare consumers on the policy side, alarm bells are ringing because I'm like, ER immediately. That means as soon as I walk in that door, my costs are going to be really high and I'm going to be up everyone's butts asking for prices immediately. But this young man, he's just trusting that the doctors, the insurance, he's done everything right. He's gone to the urgent care 3 times. He goes into the ER and they immediately over give him care that he doesn't need, bill him out the wazoo, and the insurance company in the hospital after he gets his $9,000 bill for strep throat. He comes into my office and says, what do I do with this? I said, well, you're not paying $9,000. And I'm on the phone with the hospital. Now I'm on the phone with the insurance company. And they're both saying, we don't have anything we can do in this. And that's the failure of patients' last policy making because at the end of the day, neither of their jobs is to advocate for you, the patient. They already have your money. You are not given any almost rights in the system to say, hey, wait a second. Their assumption is not, hey, we should tell this young man that he just stepped into an ER and it's going to be at least $5,000 when he walks out. Maybe we should just tell him to go to the CVS down the street to buy a strep test. And at the end of the day, there's no price transparency. There's no true informed consent about any of this. And it makes it really hard for this young man who, again, we were able to figure out and help him and get him. I think everyone realized that this was a little bit of a mistake. But that only happened because him and I were willing to spend 5 hours on the phone fighting it. And not everyone has that time or knows that they can do that either. So to my very long way, Brandon, of answering your question is price transparency is the very first step that we can take to start realigning the system to the patient again.
Yeah, and I mean it's like almost common sense. Like you go to the Target and you see your prices. That you can shop around different jeans. You can see what would be the best, and you can go online and you can see reviews. The power needs to be back in the people's hands. I'm all about the people. I mean, I am the people. I am 28
Yeah.
years old, fairly young, and I don't want to go to be in a position where in the next decade, 2 decades, 3 decades, that I'm going to be one fearing to go to the hospital, two fearing that my parents or my family is not going to get the good quality care, and then two, I know if the incentives aren't proper for these people, that they'll get up and go find a place where the incentive is proper for these people. So through my study, it's remarkable. I mean, being on my channel, I am seeing just it's like a war is breaking out between people fighting about how we need to fix the problem. But the majority of them don't really have any solutions. They just want it to be this way. They feel like this is going to work for them. And then you go and see where this socialized healthcare is taking place, and that is just absolutely making problems even worse, even worse, even worse. So I think one, competition. We need to, if we're putting in subsidy and we're subsidizing and paying for insurance companies to offer bad services or doctors to offer bad services, that these bad services can not continue to be propped up, because if you keep paying for it, they're not going to go anywhere. They're going to just keep raking in the money, and then they go home and they do whatever it is that they want. So we need, again, find, and there's people like me out here that I know want to see change, that want to be a part of change, and it's unacceptable for us to see the
Yeah.
beautiful parts of what we're capable of decaying here slowly at the whims of people that aren't even going to be here in 20, 10, 30, 40, 50 years.
Yeah.
So I think what you wrote about with the price transparent, I mean, that's like almost common. I didn't, I don't really think about it too much,
Yeah.
but with price transparency, like if you make it like a restaurant and you just walk in and you can see your prices, you
Exactly.
can shop around prices, and you can see reviews of doctors, people that actually speak on how well they're treated and their specialties, things like that. It would make a world of a difference.
And Brandon, and this is something that, again, thank you so much for this opportunity to come on here because this is something that I scream to every person who's on my team, on my staff, whether that was at HHS or my staff at AFPI or in the past. I just, the price transparency that President Trump, signed into law, he changed the regulations the first term, and he's moving even further now in this term. I need your viewers and listeners to understand that this gives them rights. This is the first thing that gives them rights. So when you go into a doctor's office, under the law, there's something called the good faith estimate that was signed into law in 2020, and you are allowed under the law to ask them what the price is, and they have to give it to you. So you can ask, and this is something that again, I don't think people like we've been conditioned to believe that you can't ask for these things. So first, I'd say ask for your prices. And that's not just at the specialty office, but that's at the drug counter. Hey, ask what the cash price is. I know you have a lot of folks who are suddenly realizing that the cash price and the insurance price can actually be really wildly different. Ask what the cash price is. I have found that if they're saying that my, stupid little medicine or whatever is 60, 70, $80, I can say, "Hey man, what's the cash price?" And they say $3. This isn't good RX. This isn't any of the little coupons. This is legitimately their cash non-insurance price, and you can get it for pennies on the dollar. And it usually is a better deal for the pharmacist too, because then they don't have to deal with all the claims information. Ask it at the medical, like at your doctor's appointment. Hey, what's the cash price? Because again, if your deductible is $9,000, you're probably not going to hit the deductible that year. So it doesn't matter if you're like $40 or $50 office visit is not counting towards your deductible. So that's just, again, you have way more power than you think you do. Good faith estimate, there's something called the advanced explanation of benefits, where they are supposed to be giving you, and the HHS is working on this. They're going to make sure that before you get any service, you get every single item listed out to the extent that they can plan ahead for that and say, you, Brandon, are going to owe $1,300 for your service. Because that also gives you an opportunity to say, hey, wait a second, what's the cash price? Or, hey, what if I don't do this? Or, hey, do I need that? Why am I getting that? Because that, again, gives you more information to give you more accountability for your health.
Wonderful. And I know you have to get going here soon. I know you have a busy day, but Hannah, I absolutely would love to dive into the other sections of your papers. I'd love to dive into more discussions about your current work. I could talk for hundreds of hours, absolutely, on these topics. I've been talking about it for years now about these topics, but I am now finally starting to broadcast them and share them. And my channel is growing at a rapid rate. I mean, we grew up in the over 20K in the last like 30 days. So, and I think we're going to be able to continue. Grace to God, because all glory goes to him. I've been praying that we can start implementing some of these systems here, because it is of the it is of the essence. Time is running out, and we need to get moving on these things quickly because one, the effect is not going to be seen right away. It is going to take time, and it's going to be compounded slowly in the beginning, gradually, but then suddenly we will see change. And it's important that we move right away, quicker, because things are decaying rapidly as well, gradually, and then suddenly. And then, secondly, education is just the number one foundation in which we'll all be able to move better, faster, stronger with one another too. Because I know people are upset, I know people are frustrated, but it's people, it's our families, it's our people. We're all here wanting to do the same thing, which is live a decent life and not be scared or scammed and kicked out of the things that we grew up on believing in. So to make a long statement short, I mean, we should talk again on a recorded channel again, just like this, and we'll dive into the sections. I think today we talked a lot about price transparency, but I think we should collaborate
That's great.
further on, going on from here.
And just if I can just double down on something that I know that you've been asking your followers for, keep sending in the stories, right? Like policymakers do not hear these and their staff don't hear these, but they really need to know what is going on the ground level. They hear from companies, right? They hear from very well connected, but they a lot of times don't hear from just like normal mom trying to give healthcare for her family and wondering why she has to pay $9,500 for it. So I'll just extol that. Keep sending in the videos and just know that people are watching them, right? Like I'm forwarding them on to friends who still work at HHS and CMS and in the administration. And we're really, again, looking at those and saying, guys, this is what the state of healthcare is in the United States. And this is the challenges that people are having. So, Brandon, I really appreciate the work you're doing to really just highlight some of the challenges and figure out how to move forward.
No, absolutely. And I'm excited because I mean, I've done the projections, I've done the numbers, and if I'm allowed to go and implement this two-step proposal, which I'll be touching on more, if in the next 4 to 5 years, 5, 6 to 10 years, it could take some time, but we will see the affordability problem go away. It's already been proven over the last several years that if we implement such a change, that we'll see it. And the transparency model is a core principle of this model. And God bless, power to the people, because it's the people that will make the changes work. And the people that are floating around, just I mean, I talk to the families every single day. I'm on phones with the families every day. I get the emails of the people that are struggling. I see it on a continuous basis. And honestly, it's been, I'm a mental health advocate, but it's draining. It's depressing. It makes me upset. It really does. And to consume it over and over and over again, I want to hit this goal quickly so we can implement this change quickly, because I mean, it's not killing me, but it's taking a toll on me for sure. But the mission is far greater than any of
Yeah.
this pain that I'm experiencing lately. But
Yeah.
I will say, I talk to the families. I hear their voices. I
Yeah.
see what they're going through. My family went through it, not on
Yeah.
a like a bad way, but they went through medical. They need to focus on the families and healing rather than
Um,
the garbage that some of them have to deal with.
yeah.
And then some closing remarks, please, if you could share where people can find you and let people know what
Yeah,
kind
of
of work
course.
that you're
Yeah, just
finishing and working on.
AmericaFirstPolicy.com. So, AmericaFirstPolicy.com, toggle over to healthcare. And in the meantime, if you're interested in anything else, we've got lots and lots of experts on a great deal of topics. And so I'm all over there on our YouTube channel, on our Instagram, all of that. So we're A1 Policy on Instagram, America First Policy Institute on YouTube, A1 Policy on X. So again, and you're always welcome to reach out to Brandon or reach out to me on Instagram. I'm private on Instagram, but feel free to reach out still, and I'll be sure to look in my little messages folder.
And then I know you also said that you'd like to talk with some of the families too. Is there a way people can take
Absolutely.
action with you that they can help bring change?
Well, they can reach out to Brandon, or they can, and we can work that way.
Yeah,
Again, maybe moving forward, the best case moving forward is giving out my email, but I'm already, a little derelict in answering
sure.
that. So Brandon for now is the best case scenario. So reach out to him and we'll all get together and hear about, what part of the law or the regulations is really blocking you from getting health care.
And we are our mission is to help fix this problem. So we appreciate you guys joining in our channel. Stay tuned. We have more videos coming soon with healthcare professionals, patients. We are here to give you guys a voice. That's exactly what we're doing. So if you didn't have a voice, you do now. And thanks again, Hannah, for joining us today.
My pleasure. Thanks so much, Brandon.
Alrighty. Bye bye, everybody.